Okay, so each of these phases is going to be 4 to 6 weeks. You have to spend at least 4 weeks in each phase to allow your body the time it needs to create that change and learn what you're asking it to do. So that first phase, the movement retraining phase, that's going to be 4 weeks at least. You can spend 6 weeks, even 8 weeks. If you feel like you haven't mastered it yet, don't move on to the next phase. Do the first phase until you feel confident to move on to the second phase, but I'm asking you to at least spend 4 weeks in each phase. The next phase is that strength phase. You're going to be adding a lot more load, a lot more intensity, a lot more range of motion, spending at least 4 weeks there, if not 6 to 8 weeks. And then the last phase, that return to running phase, what you guys have came here to do, is going to be another 4 weeks at least. Now, at the end of these phases, that is when you start to return to running. We do not return to running in phase 1. We do not return to running in phase 2. In phase 3, at the end of phase 3, you will then be able to start to return to running. I know that's probably not what you want to hear, but this is how you're going to get back safely without any pain or problems. I promise you, I do this all day long with my clients. I do it with myself. I've done it with hundreds and hundreds of people with knee pain. If you follow this and you follow that timeline, I promise you, you will see results. Okay? But you have to promise me that you're going to give your body the time it needs. That's super important. Now, let's talk about recovery and actually listening to your body. You're going to be introducing new loads, new intensities, new exercises to areas that have not had this much attention or tension itself or load to those areas. So they might start talking to you a little bit. And it's very normal in the first 4 weeks especially to actually have more pain and more symptoms, even some swelling, especially if you're dealing with a more acute knee injury. So don't panic. This is normal. But you need to allow your body the proper time it needs to recover. So you're going to be doing this program 3 days a week, 4 days max. This is not something that you're doing every single day. You're allowing for yourself to have at least a day in between for recovery so that your body can properly recover and perform the next day. If you're doing these exercises every day or multiple days in a row, you're going to be pounding an overuse injury, and it's not going to be happy. This is maybe where some of you guys have gotten stuck because you're pushing and pushing through pain when you should actually allow yourself to recover so that you can run, right? So recovery is crucial when it comes to return to running because running is an endurance sport. It's high impact, so you need to be able to prepare your body for that and slowly progress yourself to being able to do that. It's not 0 to 100. Okay, so at least a day in between for recovery. Listen to your body though. If you're having a lot of swelling, a lot of pain that's sharp, or a lot of aching pain that's lasting well beyond your exercises, maybe you need to take another day of recovery, or maybe you need to do a couple exercises here and a couple exercises there. There may be a certain exercise that you're not ready to do quite yet, so maybe hold off on that one exercise that you know is really aggravating your knee and reintroduce it later. So these things are really important. Now, I know it's really overwhelming and hard for you to tell yourself what you should be able to do or hold off on. This is exactly why I created the Facebook group add-on that you have an opportunity to join in on. It's access to me directly. So this Facebook group, not only can you guys be encouraging yourselves to be able to get back into running after knee pain, but you'll have access to me. And this is the only place where you're going to be actually able to message me on that platform and ask me any questions when it comes to your knees so I can help you guys properly get back into running safely. So you don't have to guess whether you should take another day recovery or what you should do for your swelling. You can ask me those things there. So I highly, highly recommend that you guys get that add-on so you can join in the Facebook group and you have access to me so I can help you with this. So it's not just this course that then you have to kind of guess after, I give you this information. Right. So last thing I will say is when it comes to swelling, we don't necessarily want to ice. Icing is a great way to prevent inflammation, but if there's inflammation already there, putting an ice bag on your knee is not going to get rid of the swelling. It's actually going to keep the swelling in that spot. So ice is a vasoconstrictor. It constricts blood vessels. Heat and movement opens up blood vessels. It dilates. So if you're constricting blood vessels and swelling is already in that knee joint, it's not going anywhere, right? So the best thing that you can do for swelling is actually elevating your leg, massaging the leg, the fluid up the body. So the leg has to be elevated and then massage the fluid up. And then compression. So you can wear compression sleeves. This is the best thing that you can do for swelling. The body creates swelling for a reason. It's there for a reason. The body wants to bring blood to help clean it up, to heal it. So I never really want to get rid of that process. If the body's doing that, it's doing it for a reason. Now, if that swelling is staying and sticking around and causing pain or discomfort or not allowing you to fully move your knee, then we want to try to get rid of that swelling. But if it's there for a day or two, it's totally okay. Elevate your leg, compress, and massage. Maybe you can ask your partner to give yourself a knee massage. But I would try to stay away from the anti-inflammatories and the ice, at least in the very beginning, because we want that body to be able to do what it needs to do. It doesn't do anything that doesn't have good reason, right?